Thank you for joining us today for Session 2 of the MIPS Promoting Interoperability 2020. My name is Sarah Leek, and together with my colleague Sharon Phelps, our session will focus on the objective and measure requirements for MIPS Promoting Interoperability category. Sharon and I work for Mountain Pacific Quality Health. Queens has contracted with us to help with your success in submitting data for the Promoting Interoperability, or what I may refer to as PI, category. Sharon and I have been working with the MIPS program since its inception, and together we've helped hundreds of clinics be successful in reporting data for MIPS. Due to your participation in the Queens ACO, the PI category is treated a bit differently than clinicians and clinics not participating in an ACO. We will be reviewing this category from the perspective of a clinic or clinician involved in an ACO. So if you have the opportunity to work in a clinic that is not part of an ACO or APM, what you learn today may not be exactly the same for them. Today, we will focus on how to be successful in reporting MIPS Promoting Interoperability for 2020 and cover the topics that are noted on this slide. A few important points as we get started. We have several support staff from Queens joining us today on the call: Jade Hinsdale, Stephanie Nobriga, and Kelson Oshiro. So if you have questions specific to the Queens ACO program, the Queens staff can help answer those. CMEs are available for today's session. Near the end of the session, we will post the survey needed to grant you the CMEs. Additionally, we will send out the evaluation again tomorrow to ensure you have the chance to complete it. We appreciate the attendees completing the evaluation, as it does give valuable feedback to prepare for the next presentation. We will be sending out the slide deck and recording after today's session, and Queens will be posting it on their website, so it is available for review or sharing if you need. Please let us know if you are not understanding some of what we are discussing or if you have questions, as our goal is that you have a strong working knowledge of this material when we are done. At the bottom of your screen, you will see a Q&A section. Please type in your questions and we will answer them when we get the Q&A session at the end of today's presentation. The Promoting Interoperability category consists of reporting on requirements and on measures. This slide may be familiar as we looked at it during the first training session. We felt it important to point out again the differences in these as it pertains to successfully completing and submitting information for the PI category. So requirements are items which must be completed to allow a score. If these items are not completed, the PI score will be 0, regardless of your measure performance. Requirements do not contribute to the points of the score. Measures contribute points towards the PI category score. Most measures are performance-based, but a few can be answered using yes or no. This checklist gives the items which must be addressed when submitting your data for the PI category. Notice the 3 items within the orange bracket. These requirements must each be answered yes in order to proceed to submitting the measure data. If any of these are no, then the score for the PI category will be 0. These requirements were addressed in more detail during session 1, so I would encourage you to look at that recorded session for questions around these requirements. The area we will concentrate on today are the 6 required measures as noted by the blue arrow. It's very important for you to know the functionality of your EHR so that you ensure you can report the requirements and the measures. The Queens MSSP participants use a variety of different EHRs, so we are unable to go into the specifics for these systems. So we do encourage you to speak with your EHR vendor to confirm your questions. First off, you will need to identify the version of the EHR and the CMS identification code, which you can find from the Certified Health IT product list. A link to this Certified Health IT search page is on the Resources Links page later in the slide deck. This ID number is requested during the PI submissions process. Second, you must be using the 2015 certified version to report for 2020 promoting interoperability. The certification process tests that your EHR has the functionalities built into the software that support the reporting requirements per CMS. Please verify with your vendor that these functionalities are in place and working properly for your clinic. The vendor should also have guidance and instructions on the processes and workflows for each measure. The particular logic is important so that the system will count the values of numerator and denominator in order to calculate your performance measures correctly. So you will need to confirm the functions and processes for sending and receiving patient health information using direct email addresses and protocols established by your vendor. We will be discussing this particular measure later in the session. Also, check with your vendor if you are currently connected to a registry or if your EHR has the capability of connecting to any specialized registries. So now we'll look at how you can find the detailed measure specifications on the QPP website for each of the objectives and measures. CMS has an abundance of material and training they've populated on the Quality Payment Program site. So these next 3 pages are screenshots from the site and steps to navigate through to the Promoting Interoperability resources. The QPP landing page, which is Indicator 1, can be reached by the link at the bottom of the right hand of this page, the qpp.cms.gov. Links denoted by steps 2 and 3 lead you to number 4, which is the main page for the 2020 PI requirements. This slide shows how to navigate to the individual measure specification sheets. So by scrolling down the PI measure requirement page, which was number 4, there is a link to Explore Measures. By clicking on the Explore Measures, you will reach the PI measure search page, which is number 6. You can either search for a particular measure in the location noted by 7A, or you can choose to download the zip file, which has all the measure specifications in PDF version, which is noted in 7B. I have found downloading the zip file is convenient so I can quickly reference and study the details of each measure. So the specification sheets are the definitive resource for each measure. If you are looking for details and definitions on what CMS expects for each measure, these sheets are the reference to use. We try to use plain language in our presentations to promote a better understanding. Therefore, we do urge you to review the actual specification sheets for a complete and exact description of the measures. A list of the information contained in the individual spec sheets is on the left-hand side of this slide. On the right-hand side are some sample screenshots of the particular measure provider to patient exchange. The list on the left-hand side shows the order in which the specification sheet describes details of this measure. The measure information can include the objective, measure ID with definition of the numerator and denominator, and other terms that are important to know for this measure. Scoring criteria is explained and contains if the measure requires a minimum numerator and denominator, if it is based on performance or a yes/no answer, an explanation of circumstances when the measure can be excluded, and where the points for the measure will be transferred if an exclusion is chosen. The specification sheet also has regulatory reference and certification criteria. The spec sheets are a valuable tool to reference, especially when verifying details to understand how the process and workflow is applied to your specific EHR. Appendix A of this slide deck has further information on the specification sheets using the e-prescribing measure as an example. This example is provided for your reference but will not be reviewed during our session.
Thank you, Sarah. Okay, next we are going to talk about the PI objectives, measures, and scoring. The performance measures which contribute to the PI score are divided into 4 objectives listed here in this table. We've provided this slide to give you a summary of all of them on one page, and we will be covering each of these in detail today. Each measure is scored based on the performance of the clinician or the group for that measure. For measures that have a numerator-denominator, you have to submit at least 1 in the numerator if you do not claim an exclusion. Failing to report on a required measure or failing to claim an applicable exclusion will result in a score of 0 for the PI performance category. This is one of the reasons why we recommend you locate and review the MIPS dashboard or the PI performance result report in your EHR on a regular basis. If you do not currently have a 1 in all of your numeric measures, you need to be working with your EHR to determine why not and how to ensure you get at least 1 by December 31st of this year. To score the numeric measures, you simply multiply your performance rate times the number of points available and round to the nearest number. If the MIPS eligible clinician receives a performance rate or a measure score of less than 0.5, as long as the MIPS eligible clinician reported on at least 1 patient and have a 1 in the numerator for a given measure, a score of 1 would be awarded for that measure. Okay, now let's talk about the e-prescribing objective. There are 2 measures in the e-prescribing objective, and the first is the e-prescribing. For e-prescribing, this is a required measure. To receive a score for the e-prescribing measure, you must have written at least 1 prescription that was queried for a drug formula and transmitted electronically using your certified EHR technology. The numerator collects all of the prescriptions from the denominator that meet the criteria. There are 2 possible denominators for this measure. One is for those medication orders which require a prescription but do not include controlled substances. This is because not all EHRs may be configured to allow controlled substances. And there's some special software that needs to be put in place to be able to do controlled substance prescribing, and not everybody has that yet. The second denominator is for medication orders which require a prescription, including the controlled substances. The denominator in your situation will be determined by your vendor, as they know whether or not you have that controlled substance module within your system. There is an exclusion allowed for e-prescribing. You may claim the exclusion if you meet the criteria of writing fewer than 100 permissible prescriptions during the performance period. The 10 points associated with the e-prescribing measure will be reallocated equally to the health information exchange objective, with 5 points going to sending health information and 5 points going to the receiving health information measure. Here are some steps to take to improve your performance on this measure. As we mentioned earlier, check your score on your MIPS dashboard or run your MIPS PI performance result report. Check the dashboard to determine your e-prescription rates since the start of 2020, as well as for the last 90 days. This rate will be the numerator and the denominator for this measure. If you are not currently using your EHR for e-prescription, Or if you do not see at least a 1 in the numerator in your dashboard, contact your EHR vendor for assistance in obtaining your data for this measure or to learn how to get started. They may be able to provide you training on how to use e-prescribing. Please note, there are some standalone systems that you can use for e-prescribing, but a standalone system that does not use your certified EHR technology does not meet the criteria for this measure. You must be using your certified EHR technology system. Additionally, using your EHR system rather than a standalone system may actually be more efficient for you. In my experience, I have found often when providers start using an e-prescribing system, they rapidly start to use it most of the time. They find it faster. If you do have a performance rate, look carefully at the values. Do your numerators and denominators seem to be a good representation of your patient population or not? If not, work with your EHR vendor to identify whether all data is being captured correctly. You can also look at your denominator for 2019. That may give you somewhat of an idea of how much you have been prescribing over time. If you are prescribing less than 100 e-prescriptions in your 90-day time frame, you may want to claim the exclusion. And we'll talk about that in just another minute. The second measure in the e-prescribing objective is the Query of Prescription Drug Monitoring Program measure, or the PDMP measure. Note that this is a bonus measure and it is not required. You do not need to report on this one. A prescription drug monitoring program is an electronic database that tracks prescriptions of controlled substances at the state level. Clinicians must report the e-prescribing measure to be eligible to report data for the PDMP measure. So if you have less than 100 e-prescriptions and you are going to take the exclusion on that measure, you cannot grab these bonus points if you are using the PDMP. Also, clinicians must be able to prescribe opioids electronically, which would require that your EHR have the electronic prescription of controlled substances module. Some considerations around this bonus measure. First of all, determine if this is applicable to your practice setting. Do you have more than 100 in the numerator of the e-prescribing measure? If not, you can take the exclusion for e-prescribing, but if you are doing PDMP, you may want to still report even if you have less than 100 because you get these bonus points. Also, find out if your system allows prescribing of Schedule II opioids. If not, you will not be able to take this bonus measure. Okay, Sarah, back to you.
We will now look at the Health Information Exchange Objective, which consists of 2 measures. These measures are often the most difficult in the promoting interoperability category for practices to meet. To receive a PI category score, these measures must be met either by having at least a 1 in the numerator or by meeting the requirement for an exclusion. Each measure has the potential to earn a maximum of 20 points. So when approaching the Health Information Exchange measures, note that a transition of care is not simply a referral to another provider. A transition of care is defined as the movement of a patient from one setting of care to another care setting. For example, hospital to ambulatory, long-term care to hospital. This measure includes all transitions of care and referrals that involve the clinician. So although many EHRs are capable of sending and receiving an electronic fax, this is not a form of electronic transmission as it pertains to this measure. An electronic transmission uses structured data fields that are capable of being incorporated into the EHR of the recipient. We will look first at sending health information measure for the HIE objective. To meet this measure, the clinician must create a summary of care record using certified electronic health technology and electronically exchange that summary of care record. This exchange of information must comply with HIPAA privacy and security protocols. CMS has defined what the summary of care document must include. 18 elements are listed in the measure specification document, and your EHR vendor should have the summary of care report built to automatically include all 18 elements as appropriate for the patient. The sending health information measure has been a requirement for MIPS PI category for several years. Therefore, your EHR should be well positioned to manage the electronic transfer to another healthcare entity. For the sending health information measure, knowledge of the numerator and denominator are key as you evaluate this measure. So looking first at the denominator, it is the number of transitions of care and referrals during the performance period for which the MIPS eligible clinician was the transferring or referring clinician. The numerator is the number of transitions of care and referrals in the denominator for which a summary of care record was created using certified EHR technology and was exchanged electronically. This measure does have an exclusion. If the clinician or group transfers or refers a patient to another setting fewer than 100 times during the performance period, they may take this exclusion. Keep in mind that a performance period is 90 or more consecutive days during the performance year. So if the clinician or group is able and wishes to take this exclusion, the points for this measure are reallocated to provide patients electronic access to their health information measure. The second measure under this health information exchange category is receiving health information. The measure states, support electronic referral loops by receiving and incorporating health information. In this measure, the clinician is the receiving party of a transition of care, a referral, or a new patient encounter. This means that they can receive not only documents for their current patients, but also for new patients to their practice. Your EHR should have the logic built in that will recognize those patients that are new to the clinician. When clinicians receive the electronic submission, they conduct a clinical information reconciliation for 3 clinical information sets. Those clinical information sets are medication, so it's review of the patient's medication, including name, dosage, frequency, and the route of each medication. Also, the medication allergy and the current problem list, which is patient's current and active diagnosis. For the receiving health information measure, the denominator is the number of electronic summary of care records received using certified EHR technology for patient encounters during the performance period, where a clinician was the receiving party, and this of the transition of care or referral, and also that patient encounter for a new patient. The numerator increments upon completion of the clinical information reconciliation of the 3 clinical information sets. The measure allows for other non-medical staff to complete the clinical information reconciliation under the direction of the MIPS clinician. It is important to understand the workflow and logic and confirm that the EHR captures the actions of the non-medical staff correctly. There is an exclusion for the receiving health information measure. So if the MIPS eligible clinician receives transitions of care or referrals fewer than 100 times during the reporting period, they may take this exclusion. So if they claim this exclusion, the 20 points will reallocate to the sending health information measure. So now we're going to look at some steps towards successfully reporting the HIE objective and measures. First, we'll look at the technical aspect. Verify through your EHR dashboard and your reports the functioning and results for sending and receiving measures. You can work with your vendor to set up connections to those hospitals and clinics that you frequently refer patients. You can also ask your vendor if they know of local healthcare facilities that are set up and sending or receiving from their systems to other practices that use the same system you are using. The second bullet in orange is of high priority. If results are not present, ask your EHR vendor if the setup is completed and what workflows are needed to obtain the results. You need to be certain your EHR is 2015 certified, as sometimes additional modules are required. Train your staff on the workflow logic in the EHR, so how to send, receive, and incorporate the records that they are receiving. And know your direct address to provide to your local hospital and clinicians with whom you frequently refer. So as with all performance measures, it is important to monitor your MIPS dashboard to see your results. So here are some strategies for you to consider. Reach out to your colleagues and those hospitals, clinics with whom you frequently exchange or refer patients. So they most likely have the same measures that they have to report for promoting interoperability. Ask if they are using the Health Information Exchange, how to send them your referrals or responses, and have them do the same. You can consult your vendors and or your IT personnel for testing this exchange of information. Also, verify performance of your sending and receiving measures. Are both functionalities set up in your EHR, and are you using the correct process to trigger the counts in your numerator and denominator? Does your dashboard keep you updated on measures? This will assist you in knowing your performance over time. If the numbers do not look correct, make sure to contact your vendor. Note the count in your denominator to determine if most likely you could take an exclusion because it is less than 100 count in the denominator. Is an exclusion a viable or beneficial option for either of these measures? You can ask these questions. Is the sending information measure performance better than the receiving, or is it the opposite? If you are performing well for sending information but not on the receiving information, remember that if you meet the exclusion of less than 100, then the 20 points from the receiving health information can transfer to sending information. This would allow you to concentrate efforts on improving the score for the one sending health information measure reweighted to 40 points. We will look briefly at the description of the direct email. So direct email uses specific technical standards for exchanging health information between healthcare entities, such as primary care physicians, specialists, and hospitals, using a secure, trusted network. Direct functions like regular email with additional security measures to ensure that messages are only accessible to the intended recipient. So because direct is a secure means of communication, when obtaining your direct address, you may be asked to provide information confirming your identity to ensure sensitive patient health information is protected. Direct addresses are available from a variety of sources, including your EHR vendor, state health information exchange entities, as well as private service providers offering direct exchange capabilities. These are called health information service providers, or you could hear the word HISPs. Depending on the EHR and or the HISP you and the receiving provider are using, you may need assistance from your vendor to establish this trusted relationship. Some work between the two vendors may be required in order to communicate. So the Hawaii Information Exchange is able to send and receive direct secure messages with other physicians. If you are connected to the Hawaii HIE, please check with them to ensure they have your direct addresses and to verify sending information to other physicians. The Provide Patient Electronic Access measure is to provide patients electronic access to their health information. This measure's principal purpose is to encourage communication between providers with their patients and families, as well as keep them informed of their health information. The patient or their representative must have access to view, online, download, and transmit their health information. For this measure, the denominator is the number of unique patients seen by the clinician during the performance period. There are times that a patient may be seen by the provider more than once during the time, yet these patients are only counted once in the denominator. The numerator is the number of patients in the denominator who are provided timely access to view their information. This could include the patient's representative instead of the patient. Yet patients with representative are only counted once also. The patient may use a variety of applications to connect to their patient portal. Some will use desktop or laptop computers, while others may use their tablets or cell phones. The application used to access the secure environment of your EHR is the patient's choice. We will discuss some important points regarding this measure. Timely access to patient information requires the clinician to provide patients with electronic access to their health information within 4 business days. You may not get all patients signed up for your patient portal, but the measure specification states when a patient possesses all of the necessary information needed to access their information. This may include informing patients about the patient portal at registration or sending patients the directions to access the portal and download their information. If the patient opts out, he or she is included in the denominator, and they are included in the numerator if the patient is provided information when they subsequently desire to access. Therefore, it is really important to document any outreach to the patients that's completed in an effort to provide this access. This measure has the highest weight in the Promoting Interoperability category. It is worth 40 points, and there is no exclusion for this measure. When exclusions are taken on other PI measures, it will often make this measure worth more. So, what is the exclusion impact on provider-to-patient exchange? The pie graph on the left-hand side shows the weights of the measures in the PI category. The largest is 40%, the patient access measure, with 2 health information exchange measures being the next largest at 20%, and e-prescribing and public health measures are 10% each. All measures except for the patient access measure have criteria for exclusions. And in this example, we see on the right-hand pie chart what would happen if a provider were to take exclusions for the 2 health information exchange measures. This action would increase the weight of the patient access measure up to 80% of the total category score. The key takeaway of this slide is the large amount of weight that can fall into the patient access measure. Therefore, it is beneficial to consider strategies for excluding, where appropriate and able, some measures and focus on this measure to maximize a score for PI. So knowing that this measure's percentage of the overall PI score will increase if you exclude other measures, it is important to monitor this measure and take steps to increase the performance. Certain health information must be accessible to the patient or their representatives. Those elements are spelled out in the specification sheet and include information such as the provider and care team, current and past problem list, lab test results, medication history, and immunization, to name a few. Verify with your EHR vendor that this information is available to the patient and is available within the 4 business days. If you have staff with access to their patient portal. Encourage them to review this portal information to understand the login process and the navigation within that portal. Staff will gain firsthand knowledge of the patient portal and can then better answer questions from the patients. Provide patient information on how to access the patient portal. For example, you could begin mailing patients information regarding the portal, including instructions on how to access their information and the benefits in their portal. Document this outreach in the medical record in order to meet the requirement in the measure specification. This process should be verified with the EHR vendor as to where the information specifically can be documented to capture in the numerator. Staff can also offer assistance to patients on signing up for their portal during registration or during their visit by using tablets or some designated computer.
Next, we are going to cover the last objective, the Public Health and Clinical Data Exchange objective. There are 5 measures within the Public Health and Clinical Data Exchange objective. These are yes/no measures, and there's a maximum of 10 points available for this objective. As the name of this objective implies, there are 2 groups of measures. The public health measures refer to electronic reporting to a state agency charged with gathering and tracking the data. The measures considered public health measures are immunization registry, syndromic surveillance, electronic case reporting, and public health registry reporting. The second type of measure is the clinical data exchange measure. A common type of clinical data exchange registry is one formed by a medical specialty association to gather data on specific conditions or quality measures. There are a wide range of registries for specific information available across the nation. You can have 2 registries within one measure. You do not have to select 2 unique measures from this list. Groups can submit a yes for a measure as long as one clinician in the group is actively engaged with an agency or registry. There are exclusions for these measures, and we'll go into specifics on those in a couple of slides. Active engagement is a key term to understand in this objective. Active engagement means the MIPS eligible clinician is either in the process of moving towards sending production data or is actively sending production data to a public health agency or clinical data registry. Active engagement may be demonstrated in one of the following ways. First, through completed registration to submit data. The MIPS eligible clinician is registered to submit data with the agency. The second is testing and validation. The MIPS eligible clinician is in the process of testing and validating the electronic submission of data. MIPS eligible clinicians must respond to requests from the public health agency within 30 days. Failure to respond twice within a MIPS performance period would result in the MIPS eligible clinician not meeting that measure when they're in the testing and validation stage. The third option is actually production. The MIPS eligible clinician has completed testing and validation and is actively and electronically submitting production data to the public health agency or the clinical data registry. Each measure has its own exclusions, so please refer to the specification sheets for details on a measure for which you would like to claim an exclusion. Any MIPS eligible clinician meeting one or more of the following criteria may be excluded from the public health reporting measure. And let's go through these just a little bit. So the first reason for an exclusion is that the MIPS eligible clinician does not diagnose or directly treat any disease or condition associated with a public health registry in the eligible clinician's jurisdiction during the performance period. So that might be some specialists that are not treating any of the diseases for which Hawaii would have a registry. The second is operating in a jurisdiction for which no public health agency is capable of accepting electronic registry transmissions at the start of the performance period. And the third one is the MIPS eligible clinician operates in a jurisdiction where no public health registry for which the MIPS eligible clinician is eligible has declared readiness to receive electronic registry transactions as of 6 months prior to the start of the performance period. Note the highlighted language regarding the 6 months prior to the performance period, as I'm going to be referencing that in just a couple of minutes when I talk about registries specific to Hawaii. Let's talk a bit more about exclusions, as I think many of you are going to be able to claim exclusions for this measure. There are several scenarios in scoring. First, you may submit an exclusion for one measure and submit yes for another one, and you will still get full points because you're submitting data on what you're actively engaged with one measure, and you have an exclusion for the second measure, so you've met the two measure expectation of this objective. The second is you can claim 2 exclusions if proof there are none available for reporting, and then the 10 points redistribute to provide patient electronic access. If you cannot report and you cannot take an exclusion, then you get a score of 0 for this objective, and that means you get a score of 0 for the entire PI category. So we want to make sure that you can either send data to a public health registry or you can claim an exclusion. So let's look a little bit about what it looks like in Hawaii for the public health registries. The Hawaii Department of Health has a nice table on their website of the status and availability of their public health registries. I'm going to review each of these and encourage you to think about how they might apply to your clinic for both 2020 and 2021. First, electronic lab reporting. Typically, this applies to hospitals and commercial labs. If you use a commercial lab that reports to this registry, you may get credit for that. So please talk with your commercial lab. As per the Hawaii Health Department, it is up to the laboratory to provide information to the provider or to the eligible clinician that the laboratory is acting on their behalf and that the state has certified they meet all requirements for the electronic lab reporting measure. Electronic case reporting. This was active, but has recently been placed on hold due to the COVID pandemic. If you were actively engaged in getting ready to do electronic case reporting, or you were actually sending cases electronically, then you could claim an exclusion for this measure because it is no longer, they're putting it on hold due to the pandemic. This might be an appropriate exclusion for a specialist or specialty group to take. The next one, immunization registry reporting. This registry has not been available for a couple of years. The Hawaii Health Department just updated their website that they're hoping to get immunization registry back online soon. However, this just happened a week or so ago, so you can still claim the exclusion because this was not announced more than 6 months before the performance period. For primary care practices, this would be a valid and easy exclusion to claim. Syndromic surveillance. The Hawaii Health Department has decided to resume syndromic surveillance reporting due to the urgency of the COVID-19 pandemic. However, this was just decided, so it is still available for an exclusion because it was not announced more than 6 months before the performance period. For a primary care practice, this would be another measure for which it would be easy and appropriate to claim an exclusion. So that would be your 2 exclusions if you're primary care: immunization registry and syndromic surveillance reporting. The cancer registry reporting is also no longer an option. For specialty groups, if you are involved with a registry with your specialty association, that would be an appropriate measure for you to claim in this objective. If you have questions related to the registries, please reach out to your quality advisor, your quality assistant from the Queen's MSSP group, as they are happy to walk you through the options to assist you with this objective. If you take an exclusion, as we just talked about, it is important to gather and keep documentation that you meet the exclusion. On the previous slide, we included the link to the web page with the table we just reviewed. If you are going to claim an exclusion for one or more of these measures, simply capture a screenshot showing this table. Be sure to include the website where this table is located, as well as the date stamp from the system tray as shown by the orange arrow. You will want to take this screenshot during the 90-day performance period you select. If you select a performance period earlier in 2020, please take a screenshot of this table as well as some of the narrative explanations a little lower on this page that I'm not showing. That way you have something to show that they were not available for you to use in 2020. Now that we've reviewed all of the measures and objectives, here's a summary of important steps to take to improve your score. Sarah and I have emphasized several times how important it is to check your MIPS or your PI dashboard. If you have any questions on how to find your dashboard or report of your performance, you can ask your vendor or you can contact your quality assistant at Queen's. If you use Epic or Elation, please reach out to the Queen's staff first, as they are very familiar with those systems and can help you. You also may want to change the time frames of the dashboard or the reports to see if you've performed better over different 90-day time periods. If you are missing data in any measures or all of 2020 so far, you still have time to get in a good 90 days starting October 3rd, but you'll want to figure out how to get results for all of those measures as soon as possible. Many clinicians find using e-prescribing is helpful once they learn the functionality, and you can get a strong score on that measure if you use e-prescribing consistently. In 2019, the hardest measure to meet was the receiving health information. Make sure you know your direct address so you can share with other clinics so they can send you referrals and transitions of care document. In fact, if you know your direct address, please make sure Jade at Queen's knows that, as she can ensure they get it put into the Epic system, so anything that you get from Queen's, they can send you the referral into your system. Okay, next steps. The first thing I want to remind you is that you were sent an assessment a couple of weeks ago, and that assessment basically walked through all the steps of looking at your performance results for the PI category. So that is due, I think, today, that you turn that assessment in if you've not already done so. That lets Queen's see how everybody's doing on the PI category and gives them some information to help determine what help you may need down the road and what other assistance we may be able to provide. You also want to send your EHR measure report and dashboard to Queen's. They're going to have you do that monthly so they can see how you're tracking, where the problem areas might be, and where they might be able to help you. You also want to be able to monitor those PI measures and request assistance if there's one where you think you could improve and you would like some help. On November 4, we are going to be having another session where we're going to talk about how you report your promoting interoperability information in the MIPS program, and we'll walk through how to do that. November 13 is when Queen's will have determined who is going to take the exclusion for the PI category and who they would like to actually use data from. So that's the time frame they've decided to, by when they'll make that decision. The end of the year, December 31, is when you have to have put in the application for an exception if you are not going to report anything in the PI category. In our first session, we talked a little bit about the exception. We didn't talk about it much today. So if you need to know about that, go back to the slide deck for session number 1. But that exception application has to go in by December 31st. You will also want to have HARP access into the QPP portal by December 31st, either because you have filled out an exception or because you are getting ready to actually submit promoting interoperability data. CME is available for today's session. In order to receive these, you can use the link, which we're going to get pasted into the chat box. You must provide your contact information and correctly answer the first 3 questions of the evaluation. Your contact information is important so you can receive the credit earned. If you have somebody that you would like to refer this slide deck to, and they want to get CMEs, there is a different evaluation you have to fill out if you are watching it after, not the live session, but the recorded session, and there will be a different button and a different link for that on the Queen's website. Even if you are not a provider who wants CMEs, we request that you complete the evaluation so we can use that to prepare for the next session. Your feedback is very valuable for us and we use it towards improvement. Okay, now it is time for questions. And let me check the chat box to see if we have anything in chat. Okay, there we go. Jade, thank you for putting your email address into chat so that people can share their direct email address with you. That's very good. If you have other questions, please put those in chat. We have a few questions that we're going to be covering from questions we've gotten before. So, Sarah, who should the clinics contact if they have any questions about what we covered today?
Hi, Sharon. Thank you. I think you covered that a couple times in your slides, but the clinics can contact the Queen's Quality Practice Assistants, and they're within the Quality Performance Improvement Department for Queen's MSSP. And some of you may have already reached out to Stephanie Nobriga. There's Kelson Oshiro and also Jade Hinsdale. And Sharon, another question that we have was, what should I do if I am showing 0 in the numerator and denominator of the receiving health information?
That is not an uncommon thing that we found last year. That was the hardest measure for people to meet. And they seem to have everything set up in their system to be able to send information out, because the sending health information measure has been around for a while, but the receiving was a new measure. So the first thing you want to check is you want to talk with your EHR vendor or talk with your quality assistant at Queen's. But you want to make sure that you have a direct email address and that anybody who might be sending to you has that. So for example, if you get referrals from Queen's from patients that are discharged, you need to make sure that Queen's has your direct address so they know where to send that to. If you do not know your direct address, talk to your vendor. Most vendors supply the direct address, but some of them you have to go elsewhere. The other thing you may want to do is make contact with the Hawaii Health Information Exchange and see if they're getting any referrals for you in their system and if they have things set up. Because if they don't have your direct address, they may have people that have tried to send to you, but if they don't have your address, they can't actually connect all the way through to you. So that direct email address is really kind of the key piece, as well as making sure you know the workflow and know where to go into your EHR to actually see what you have been receiving. If you haven't been doing this, you may actually be getting stuff, you just haven't gone, you don't know where to go in your system to go look for it. So that would be knowing the workflow from your vendor to be able to fix that problem.
All right.
Okay.
I don't see any questions in the chat.
Okay, so let's talk a little bit about some resources. CMS has published a quick start guide for the promoting interoperability category, and we have a link to that here. You can get updates from CMS on the MIPS program by subscribing to the QPP newsletter. And we have a link right there. And at the bottom of the page of the qpp.cms.gov webpage, there is going to be a place where you can enter your email and subscribe for the newsletter. We've also included a number of additional links. The QPP resource library has hundreds of documents, and it also has a nice search capability, so you can search just for MIPS and just for the PI category, and it will give you a number of different resources to help you as you learn about this category. We use a lot of acronyms because CMS has a lot of acronyms, and sometimes if we don't, it's quite a mouthful to get through everything. So here's a list of common acronyms that we use in case you're wondering and need those. This is also nice to have when you review some of the documents, because often the documents from CMS will use these acronyms. Here is our contact information. As Sarah said at the beginning, we do support many clinics. In this case, we really are supporting Queens to support you. But if Queens has questions, they reach out to us so we can help them get your question answered. And finally, what we have today is we have two appendixes, as Sarah mentioned earlier. One of those walks through what an actual specification sheet looks like. And the other one talks a little bit more about the exceptions if you take the exception from the PI category completely. So that is the end of our presentation today. Jay, do you have anything else you would like us to add before we end?
No, thank you guys so much for attending, and thank you, Mountain Pacific, for leading this presentation.
Okay, you will be getting follow-up information on the slide deck and the evaluation. So have a wonderful rest of the day.